Welcome back. This morning we are getting ready to turn our focus to those who are battling a disease called multiple sclerosis, or MS. And the real question is, what does today's diagnosis mean? Well, today here to tell us more on why people living with multiple sclerosis have options to live their best life is Dr. Ann Bass, the president and shareholder of the Neurology Center of San Antonio. Good morning.
Good morning. Thank you for having me.
Yeah, thank you for being here this morning. I do think this is, very interesting. First, how common, how many people are we seeing that are being diagnosed with multiple sclerosis today? And what does a diagnosis mean today?
So there are 400,000 patients in the U.S. living with MS, about 2.2 million worldwide. Living with relapsing MS in this last 2 decades have been actually very optimistic and has very good outlook for the patient, especially with MS therapies that we have within the last 2 decades. So that I really encourage our patients to get treated early, because early treatment can really impact better outcome for the patient.
Have we figured out yet what causes this? Is that part of the research that's being done too?
There are ongoing research looking at the cause of MS. We know that there's a combination of factors, including genetic, environment, and infection, that can trigger the onset of an autoimmune disease like MS.
So in looking ahead to the future and the treatment options, give people some hope this morning, as I know you are excited to do, about kind of the future of this.
Yeah, it's a very exciting time for patients living with MS, especially like I mentioned, in the last 2 decades. We now have 11 FDA-approved MS therapies in the U.S. to be able to really help control this disease. So patients living with MS can lead a very full life. One of the most exciting treatment came about last year. The FDA approved a medication called Lemtrada. It is indicated for patients living with relapsing form of MS. It's basically shown to help patients reduce their relapse by about 49% against an active treatment, reducing or slowing down disability by about 42% against an active treatment, so that patient can really manage the signs and symptoms of MS and be able to live a very full life.
All right. Well, I guess if somebody wants to find out more info, where's the best place to send them?
So I encourage patients out there to discuss with their healthcare provider, because every patient is different, so that it should be an individualistic treatment approach for each patient. So that I encourage them to go on moreaboutomstreatment.com to learn more about MS therapy, specifically Lemtrada.
Well, glad to hear that there is some good news about the future of the treatment. Thank you so much, Doctor.